Let me tell you a little bit about Orange County Medical and Disc Institute and how it is that we're different from other clinics. In this clinic, when a patient comes in with a problem, the first thing we have to determine is, do they have a muscle, bone, joint, or disc problem? Once we have done a thorough exam and done x-rays if necessary and any special studies that we might think might be necessary for the patient at that time, then we sit down as a team and we determine what the cause of the problem is. We determine the necessary approach to actually fixing the patient, how to get to the cause and actually correct that problem. There's a multidisciplinary approach here. We have a medical doctor on staff. We have a physician's assistant. We have chiropractors. We do a lot of rehab. There's physical therapy. There's massage therapists. In this clinic, as we are treating a patient, we will look at the best possible outcome based on what it is we can provide the patient. Do they need decompression for a disc problem? Do they need enzyme injections for trigger points or to get the muscles to relax that just won't relax? Do we need deep muscle therapy? Most of what we do is consider rehab. We have to really work on changing the way the muscles either hold the joint or the spine so that we can correct the underlying condition. Unlike many chiropractic clinics and some physical therapy clinics, when you go in and you try and strengthen an area or you're getting an adjustment, oftentimes this will create relief, but eventually the pain will unfortunately return. In our clinic, we do correction where we can actually change the muscle memory. If you're looking at a spine and you have a spine that's just not right on an x-ray, we can actually change that by working with the muscle memory, the muscles that actually attach to the spine, and a part of the brain that actually records our muscle memory so that we can change that and create an actual change on the x-ray where we're getting a permanent relief from the problems that the patient has. Something that's not going to be temporary, but in fact permanent. That's what we look to do. Sometimes we catch a patient too late, in which case we're very, very upfront about that. If we check out a patient and we do a thorough exam and we take an x-ray and find that it's just beyond our scope or that the patient is beyond what we can do to help, then we'll know where to refer them. But we can help most patients with any type of problem as far as the physical body is concerned.